This presentation is on Hispanic cultural practices, specifically Mexicans, and it is presented by Isabelle, Karen, Kayla, Gisela, Caitlin, Kenneth, and Nubia. The learning objectives are to discuss the connections between Mexican culture and health, to indicate typical healthcare practices, beliefs, and services used by Mexicans, to investigate health risks that are prominently shown in Mexicans, and to describe proper ways that Mexicans are to be treated by medical staff.
Some key historical and background points are that Mexico originated from Mexica, which is the name of an indigenous group that settled in central Mexico in the early 14th century and are better known as the Aztecs. Mexicans make several cultural subdivisions within the nation. Some of the more common ones, northern, central, and south or southeastern Mexico. In 1950, the total population was approximately 25 million, reaching 50 million by 1970. These numbers come to show the rapid rate of the demographic growth in Mexico. In 1999, the national health system consisted with more than 17,000 medical units, a budget of nearly 11 billion US dollars, and employed around 300 doctors and nurses. And an interesting fact is that a Mexican inventor created the first birth control pill. His name was Luis Ernesto Miramontes Cardenas, which by the age of 25, he created the main component of these pills.
My slides are touching on the topics of healthcare and illness and defining them. So what is healthcare and illness? Healthcare is basically efforts made to maintain or restore physical, mental, or emotional well-being, especially by licensed professionals, doctors, trained professionals. And illness is a broad term that defines the poor state of mind, body, and to a certain extent, spirit. And I feel like every culture has a different definition of illness. So for example, in relation to Mexicans, I found this really good quote from Spectre. It says, "The meaning of health varies among Mexicans. Some may maintain that health results from good luck or is a reward for good behavior." And personally, I think this is very true. I am Mexican myself, and my family comes from Guerrero, Mexico. And in their pueblo, it is believed that if you're sick, it's because you performed a bad deed or somebody cursed you. But if you are healthy, it is seen as that you are a unsinful person, that you perform good deeds in your life, that you're living by God's word. That's why you're not sick. So I think that's very interesting to me how my family believes that. And then, overall, Mexicans, we believe more of in folk illnesses. And basically, folk illness is a type of illness that is only recognizable between a specific society or culture. So some examples of this are mal de ojo, envidia, susto, and pacho. So overall, healthcare and illness to Mexicans is seemed, I feel like, more as a spiritual way, that we see it as through luck and religion and through good behavior.
The healthcare systems and services typically available to Mexicans here in the U.S. is something that's been previously passed, which is called Patient Protection and Affordable Care Act, also known as the PPACA. This potentially reduces the number of uninsured Mexican Americans. Under the legislation, documented immigrants and U.S.-born children of immigrants be required to obtain health insurance, and they are eligible to purchase insurance through health insurance exchanges. Another thing that's available here is herbalist shops. Here you can buy any types of herbs, teas, organic medication that is brought from Mexico. It's called hierberia in Spanish. Something that both the US and Mexico have are curanderos, which is healer. It's a healer who uses folk remedies. Typically, curanderos are more seen towards the south side of the US, closer to the border. Another thing that's seen in Mexico and in US is the use of home remedies, basically drinking herbal or spiced teas and seeking care from relatives, neighbors, community members, or traditional healthcare providers. The difference is, though, Commandery in the US is more secluded and isolated, and everyone keeps more to themselves, whereas in Mexico, they have commanderies where you can rely on your town for aid. As you can see in this picture below, you see an injured person and there's people surrounding that person, and you see the herbs on the floor, and you see how they're all trying to help the injured. In Mexico, typically older generations live on farms and large lands that's far away from the city, and in the cities, that's where all the clinics and the hospitals are at. They have to rely more on these type of scenarios where they have to rely on the community around them. Also, the healthcare system in Mexico is quite affordable. A trip to a doctor's office will run roughly about 400 pesos, which is equivalent to 20 US dollars. And if you were to visit an emergency room, it would be around 350 to 500 pesos, which is basically 18 to $25. Compared here to the US, where if you go to a doctor for a checkup, it runs from $100 and above. Mexicans do have access to accessible and affordable healthcare depending on their immigration status. Documented, they are potentially allowed to have health insurance. Many people are not very educated on how the health insurance process works, or they just cannot obtain it. And especially undocumented immigrants that are Mexicans, they have no chance of getting any financial support from the government because of their legal status. Another reason why it's an obstacle to even have access to healthcare is that language barrier. Studies have found that language barriers between providers and patients may result in excessive ordering of medical tests, lack of understanding of medication side effects, and providers' instructions. This leads to it being too costly. If you don't understand what the doctor's asking, then you're going to be getting things that you don't need, meaning that your medical bill is going to be even higher. That's why a lot of Mexicans avoid going to clinics or hospitals, and they rely more on home remedies.
Concerns and circumstances in the Mexican community. According to Hispanic Health, Mexicans/Hispanics are the largest racial/ethnic minority in the US. About 1 in 6 people living in the United States are Mexican, and it's predicted by 2035 this could be 1 in 4. The CDC also reported their first national study on Hispanic health risk and the top 10 leading causes of death in this community, which the top 2 were heart disease and cancer, accounting for about 2 in 5 deaths, which is similar to cases in whites. And even though statistically Mexicans have lower death rates than whites, which is about 24% lower, in general, the mortality rate is higher in cases of diabetes, chronic liver disease, and cirrhosis in Mexicans. And Mexicans are also 3 times more likely to be uninsured as whites are. It just depends on whether you were born in the US or another country. And foreign-born Mexicans have half as much heart disease and lower chances of getting cancer and high blood pressure compared to those who were born in the United States. And social factors also play a major role in Mexican health, because 1 in 4 live in poverty, 2 in 3 complete high school, and 1 in 3 don't speak English, which creates a barrier for them in their health.
When it comes to health beliefs, Mexicans believe that an illness can be caused by witchcraft, possession, or envy. They believe in the mal ojo, which means bad eye. It is believed to result from jealousy of another person among you. They believe that spells can be cast to get back at a rival. They believe that envy can be the cause of an illness and bad luck. Hispanics believe in curadores, which is a histolic healer that can heal them spiritually and heal any pain they are feeling in their body. Hispanics believe that God and evil spirits can affect your well-being. That being said, if they sin, they feel that an illness can come upon their body. The most important belief they have is that faith and church are the strength in times of sickness. When it comes to health behaviors, they believe that visiting shrines is important. They also make a promesa, which is a promise to God or to a saint. They offer medals, such as pinning it to the saint and lighting candles at church. They also offer special prayers at home, church, or in shrines. Mexicans believe that it is important to baptize infants because that means that God will be protecting them. They also seek care from family first before getting help from a professional or seeking medical care.
So for my part of the presentation, I looked at the social-cultural factors um, within the Mexican subgroup of the Hispanic culture. And what social cultural factors are is that they're health factors that typically reside within a culture or the subgroups within that culture. And I wanted to start off with the statistic. It says, as an entire cultural group, Hispanics are 3 times more likely to lack health insurance than white adults, which often lead to greater risks because they don't have that physician telling them, oh, you need to control your weight, you need to watch your eating, you need to do more physical activity, you need to do this, do that. They don't have that guidance to keep them on the right track to remain healthy. And with this comes that Hispanics are 1.7 times more likely to be diagnosed with diabetes than non-Hispanic whites. And of the between the different subgroups such as Puerto Ricans, Cubans, Mexicans held the highest percentage of being diagnosed with diabetes than any of the other subgroups, and they held that percentage at 13.8%. And looking at obesity, which is what typically comes along with diabetes, since they hold such a high risk, is that assist shows that in 2016, Mexicans made up 24.2% of the obese population. So of all the people that were obese, Mexicans made up 24.2% of that population. And typically, the reason why Mexicans hold such a high risk of being diagnosed with these type of diseases is due to kind of like their cultural aspect. Like, it's being Mexican myself, I know, and growing up in a Mexican household, it's considered rude when you go to someone's house and they offer you food and you say no. That's deemed rude. And with our food being in such high, our food isn't the healthiest. Mexican food isn't the healthiest. It's high in fat and calories, and when you're just constantly accepting food in order to not be seen as rude, it just increases your chances of being diagnosed with these type of diseases even that much more. And those are two of the main social cultural factors that typically reside within Mexicans um, under the entire Hispanic culture.
So for the hypothetical character, I came up with a character named Rosa Ramirez. She is 46 years old. She is Catholic. Her gender is female. Her sexuality is heterosexual. For language, she is fluent in Spanish, understands very little English, and for medical beliefs, she believes in spiritual healing and prayer. So to provide this character with proper medical attention, one will have to have a translator. So there's proper communication between the patient and the healthcare provider. So there's not any like mix-ups, no mistakes, especially when like giving a prescription to the individual. She needs to know, like, in her language how to administer the drugs, and so she doesn't like take the wrong dosage, take the wrong amount of pills. And also the doctor needs to be like considerate of her beliefs and how she views illness as well.
This slide demonstrates culturally competent healthcare. To provide appropriate care for Mexicans, you need to show simpatía, which is kindness. It emphasizes politeness and conflict avoidance. You also need to show personalismo, which is friendliness or a personal connection. Personalismo can be achieved by asking about the patient and his or her family and making small talk. Because people stand closer to each other in most Latino culture, physical proximity is also perceived as being more personable. Respeto, or respect, implies attentive concern for the patient in respect of his or her personhood and age. Especially if the patient is older, they'd rather be referred to as señor or señora or don or doña with their full name after. Modestia or modesty can be used by medical staff by seeking a patient's permission before making physical contact during an examination. Latinos may be conservative in this area, and a chaperone is often appreciated if a same-sex physician is not available. It's good to have bilingual staff. However, when communicating through an interpreter, speak slowly and clear. For literate patients, it may be helpful to write things down even if they must be done in English rather than Spanish. The instructions can be studied by the patient or translated when time permits. Obviously, Spanish handouts are always a better option. It's also good to include their family if a major diagnosis is happening. Since family is very important to Mexicans, it may be helpful to speak with both the patient and family members. However, to protect confidentiality, seek a patient's permission first.